Hi, I'm Adam Putnam, and I'm proud to represent Florida's 12th Congressional District. Today I want to talk a little bit about health care. Obviously, the health care debate is a raging one across the country. There are very few issues that are more personal than the issue of health care to every single American, and Congress is embarking on an artificial deadline, but one that is very accelerated that could turn as much as 1/7 of the U.S. economy on its head between now and the end of July. So let's start with some of the basics about American health care. It makes up 17% of the U.S. economy. And currently, there are around 45 million people in this country who are uninsured. But when you really drill down into those numbers, you find that as many as a third of those 45 million are eligible for existing health care programs, Medicare, Medicaid, S-CHIP, but are unenrolled for any number of reasons. But there is a health care option there for them. A high percentage of those who are uninsured are the 18 to 24-year-olds who are young and bulletproof and think that they don't need health care and are not willing to spend the money on health insurance premiums when they feel that they are not major consumers of that health care product. So they choose to be uninsured because they work for a small business and would rather have that money in their pocket for other uses. As many as 10 or 12 million of the uninsured in America are non-citizens. They are individuals who are in this country illegally, and they present their own unique set of issues about how we deal with that. So solving the problem of the uninsured does not in and of itself require us to socialize or nationalize America's health care. It does, however, I think, indicate a problem that needs to be dealt with. And as we view the issue of health care, certain guiding principles ought to drive this debate. Number one, we must protect the relationship between a patient and their physician. Not have a government bureaucrat with all the efficiency of the Driver's License Bureau and the empathy of FEMA dictating healthcare decisions for you and your family. We can do a better job of improving outcomes in America through managing chronic diseases, through wellness and prevention programs. We can incentivize people to lose weight, get healthier, manage their diabetes, manage their heart disease, and keep Americans healthier with a higher quality of life and living longer. We can use ordinary technology that most of us take for granted to improve the healthcare sector. Electronic medical records, health information technology are all examples of things that can bring down costs and avoid confusion and avoid medical mistakes that cost 98,000 lives per year. It doesn't require a new healthcare bureaucracy to accomplish that either. We can improve access and choices by having a thriving market-based competition in healthcare, where doctors decide which specialty they want to train for, where patients decide which hospital they want to go to, where people have the mobility that we've all come to expect in a country like the United States. And we can preserve and even improve on competition in healthcare to bring down costs through things like small business health plans that would allow every small restaurant in America to pool together and have the bargaining power of McDonald's, that would allow every farmer in America to pool together and have the bargaining power of a Fortune 100 company, that would allow any small business, any individually self-employed, a realtor, a contractor, a consultant working out of their spare bedroom to pool together through small business health plans and benefit from lower costs and more benefits as the larger corporations and unions do today. We can allow people to buy health insurance across state lines so that states that have higher mandates, more mandates that drive costs up, will be competing with other states for patients' business. And we can continue to focus on quality through transparency in billing, transparency in evaluations of our doctors and evaluations of our clinics and hospitals. We can allow patients to make better decisions about where they seek out health care. So these are the things that I believe are more focused on freedom, more focused on liberty, more focused on choices by the patient in a relationship with their physician that doesn't have government as the intermediary. These are the principles that will guide me as we approach this debate. These are the principles that I hope will guide my colleagues as this marking up of the health care plan will begin as early as next week. And hold on to your wallets. because there are all kinds of proposals out there to pay for what could be as much as a $2 trillion bill that include taxing your soft drinks, a surcharge, which is a tax on small businesses, and even new Medicare taxes. These are unacceptable options in a time when we're facing record unemployment and tough economic times. So stay tuned, pay attention, be sure and let us know your opinion. Log on to our website at www.adamputnam.house.gov. Thank you very much.